Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Melor binti Amran from College Community Selanda Melaka, and today we would like to present paper Perception on the Needs for Computer Ergonomic Program and Training in Community College. The personal computer PC can be defined as a digital computer whose size, capabilities and price make it feasible for individual use and designed to be used by only one person at the time. Ergonomic play an important role to ensure capacity and capability will perform. When a person understands and learn about ergonomics, it helps to improve working environment so that people can work comfortably and use minimum amount of energy. Ergonomic is concerned with developing knowledge about human capabilities, limitations, and other characteristics as they related to the design of the interface between human and other system components. The development of computer technology, especially notebooks and laptops, has moved a much faster pace than ergonomic study. Unhealthy posture leads to discomfort and injury. Carpal tunnel syndrome is perhaps the most frequently mentioned type of injury. While Department of Occupational Safety and Health 2016 reported an increasing number of MSD cases among workers from year 1995 with only 5 MSD cases until year 2009 with 161 MSD cases, and this number is expected to increasing by years. This shows that awareness level about ergonomic and safe computer practice need to be improved. Overall, the research problem that has been identified for this study, Perception on the Needs for Computer Ergonomic Program and Training in Community College, has increased the number of MSD patients, especially among the college and university students. In addressing the above research problem, this study had determined study perception on the requirement for computer ergonomic program and training in community college. Literature review from Han 2012 said knowledge of ergonomic is required to discipline computer user to avoid certain risk factors that can contribute to the development of musculoskeletal symptom and musculoskeletal disorder. And Westrow 2000 said the knowledge and application of ergonomic can serve to prevent the onset and progress of musculoskeletal injury and improve one's health status. Santakumari, Eldert, Sridharan and Gopal 2012 said ergonomic training is frequently reported as the effective way to reduce the incidence of MSD. Methodology. The total numbers of 400 questionnaires distributed with the total target of 374 respondents from various demographic backgrounds. The number of respondents of 374 reflected that this study catered adequate sampling size based on the total population of 1,860. The respondents for this study were among the community college students located around Melaka, with a total of 6 community colleges. Result and discussion. Based on the primary data from the 361 questionnaire, or 90.25% of valid response, most of the respondents are male, that happen to be 52.4%, or 189 respondents, and remaining of 47.6%, or 172 are female respondents. On the BMI factor, majority of the respondents hold a normal weight, which about 85.3%, or 308 respondents, followed by 9.4% of those in the overweight category, and 3% are identified as underweight. For the purpose to analyze the respondent perception on the need for computer ergonomic program or training in community college, this information was collected. As many as 58%, or 208 of the respondents strongly agree that it is important from them to know the correct ergonomic practice to use their personal computer, while 23% or 82 of the respondents moderately agree that it is important from them to know the correct ergonomic practice to use their personal computer. Only 6% or 24 of the respondents found it is not important from them to know the correct ergonomic practice to use their personal computer. This pie chart shows the summary of the respondent perception on the importance to follow the computer ergonomic principle. As many as 60% or 215 of the respondents strongly agree that it is important from them to follow the computer ergonomic principle when using their personal computer, while 22% or 81 of the respondents moderately agree on this aspect. Only 6% or 23 of the respondents found it is not important for them to follow the computer ergonomic principle when using their personal computer. This pie chart displays the summary of the respondent perception on the benefit of practicing computer ergonomic to prevent from MSD. Many as 56% or 200 of the respondents strongly agree that by practicing computer ergonomic can help them to prevent from any musculoskeletal disorder. Addition, 23% or 81 of the respondents moderately agree on this aspect. In addition, 23% or 81 of the respondents moderately agree on this aspect. Only 9% or 33 of the respondents disagree that by practicing computer ergonomic can help them to prevent from any musculoskeletal disorder. The pie chart shows the summary of the respondent perception on the ergonomic education curriculum. As many as 49% or 177 of the respondents strongly agree that ergonomic should be a part of the education curriculum. Moreover, 23% or 82 of the respondents moderately agree to include the ergonomic topic be a part of the education curriculum. Conclusion: majority of the respondents strongly agree that it is important from them to know the correct ergonomic practice to use their personal computer. 60% of the respondents strongly agree that it is important for them to follow the computer ergonomic principle when using their personal computer. And 56% of the respondents strongly agree that by practicing computer ergonomic can help them to prevent from any musculoskeletal disorder. 177 of the respondents strongly agree that ergonomic should be a part of the education curriculum. Computer ergonomic training could be effective in increasing ergonomic knowledge, reducing discomfort, and promoting healthy practice. Computer users of all age should be educated about ergonomic through early effective health education intervention in order to minimize the impact toward their health and quality of life. Thank you. Safety first and quality always.